Hello, good morning. For today, I'm going to give the lectures on avian tumors as part of the lectures on poultry pathology. So, this would be the second week of lecture series that belongs to the poultry pathology that uh, review the some diseases. So one of the most important disease that we can find in avian in chicken is tumor, and mostly the tumor in chicken caused by infectious agents. Here you can see this is the case of Marek, Avian Leukosis, and Reticuloendotheliosis. So these three diseases all caused by infectious agents. So I'm going to explain one by one or each of these diseases. Okay, just like I said, this is a disease that causing avian tumor, and all are infectious diseases. MD is Marek, AL is avian leukosis, and RE is reticuloendotheliosis. So I'm going also to explain what is the differences uh, among these diseases. Here, this is the causes of the tumor. First is MDV, caused by the alpha herpes virus. There are some serotypes of MDV, and one of the serotypes that we have to stress on is this oncogenic viruses, because this strain causes tumor in chicken. However, there are also other serotypes like serotype 2 and 3, which is not causing tumors, and even serotype 3, it even do not cause any disease in chicken. Therefore, this serotype 3 usually utilized as one of the candidate of vaccine. This is what we call as HVT, or herpes virus turkey. And MDV is part of as a part of DNA viruses. And then there are also ALV, or avian leukosis virus. The etiology is the alpha retroviruses. There are subgroup, and here it starts from subgroup A to subgroup J. So there are many of subgroup in these viruses. Maybe it's due to the type of the viruses that involved in ALV. Here you can see this ALV is RNA viruses. So RNA viruses usually can have a so the RNA viruses, they might have a mutations because the RNA, they do not have what we call as proofreading mechanisms to fix the copy of the RNA. They don't have what we call as the polymerase enzyme for RNA. And this ALV virus also causing other type of tumor in animals. We call it as avian sarcoma and avian leukosis. The most type of this ALV, they cause this disease, leukosis. It means leukosis because they cause tumor in the white blood cells or in the leukocytes. And then there are also retroviruses. This is RNA virus. And this retrovirus, it seldom happen. Uh, Actually, uh, we haven't found this disease in our necropsy room, but this set of viruses, if there's an outbreak, it can be quite severe. And just like ELV, REV also do not have any vaccine against this disease. However, for MDV, there are some vaccines that can cover the MDV uh, MD vaccinations. So this is the type of the tumor cells involved in the avian tumors. For Marek or MD, it is actually lymphoma. It means it's originated from lymphocytes. They show a mononuclear pleomorphic cells. It means they have a single cells tumor with single cells. Pleomorphic means they will show a different size and different shape. So there are many variety on the shape and also size of the tumor cells. And besides lymphocytes, this tumor also can be originated from other type of lymphocyte, for example, young lymphocytes called lymphoblasts, or differentiated lymphocytes like plasma cell, and even it also the tumor subsets can contain some macrophage. Different with MD, ALV, they will cause sarcoma, but this is seldom occur, but most sarcoma tumor, so if it's sarcoma, it originated from a stromal cells or supportive tissue, like the tumor can arise in blood vessels, connective tissue, okay, and sometimes also in the lymphocyte, and not sometimes, but mostly also in the lymphocytes. And even in this ALV, they also related with epithelial tumors. So if it's epithelial tumor, it might be called as uh, carcinoma. Okay, and as you can see, just like Marek disease, ALV can be also originated. Most of the case of ALV originated from lymphoblasts and even also other cells that actually originated from the bone marrow, like erythrocytes producing cells, erythroblasts, and then leukocyte producing cells or myeloblasts, or also the differentiations of this myeloblasts called myelocytes. So although it's also originated from sort of subsets of lymphocytes in ALV, but compared to Marek, it's a different stage of differentiation compared compared with the between each of this tumor. So same from the lymphocyte lineage, but different stage of differentiations. And then REV, this is also lymphoma, and it, if you can see here, it's also originated from lymphoblast tumor cells. So it's almost this is similar with ALV, okay, but however, we can use some ancillary tests or supporting tests to further identify these diseases. Here, this is the morphology of the tumor. This is the lymphoma caused by Marek disease, originated from subsets of lymphocytes lineage, lymphoblasts. Here, this is the lymphocytes, the large cells like this, probably this is the lymphoblasts. Okay, and these cells here with a thick nuclear membrane, this is the plasma cells. And then for ALV, if you can see here, the ALV originated here from lymphoblasts. And here, can you see the differences? In here, in the Marek disease in MD, you can see a different size and different shape of tumor cells. However, in ALV, they have similar size and similar morphology. Okay, we call it as monomorphic cells, all large cells with small cytoplasms. This is probably the lymphoblasts. And one subgroup of ALV we call as ALV subgroup J. They also can cause a tumor that arise from the myelocyte. Here, this is the myelocyte. So for myelocytes, they will have a lobulated nucleus. It's not round. The nucleus is not round, with eosinophilic or red granules in the cytoplasms. And here, this is the REV, large cells with small cytoplasms. Okay, large cells with small cytoplasms, it's lymphoblast, but if you compare between REV and ALV, yes, there are differences, although almost similar shape, but as you can see, the tumor form, for example, here in the REV, you can see in the nucleus, they have a vacuolated nucleus here, okay, spaces, vacuoles inside the nucleus, uh, and also thick nuclear membranes, okay. But sometimes it is difficult for us to differentiate between ALV and REV. So we have to consider other techniques to further identify the disease. So this is other important aspect of tumor disease in chicken. First is between Marek disease, avian leukosis, and reticuloendotheliosis. They can have different route of transmission. For MD, cases of Marek disease caused by horizontal transmission, whether it's direct uh, between chicken among chicken, and or direct contact between infected chicken with non-infected, indirect or indirect, it means also from inhalation, in particular from the feather follicles. So infected chicken with Marek, their feather follicles will have large amounts of viruses that become the source of infections. And ALV. ALV, it also can spread through horizontal route. It means it can be direct or indirect, in particular by contact. However, for ALV, they do not spread from the feather follicles. Okay, so maybe excretions or from feces, uh, from feces from the infected chicken. The feces can be source of infections, and it can be also the transmission of vertical. Means vertical is from the hand. Okay, from the hand, from the female chickens, it's directly transmit the viruses to the ovaries. Therefore, the eggs will be contaminated with this virus, and then the chick, the day-old chick, will have this disease earlier. So since they are still in the when they are still becomes an eggs, or the embryo already formed, uh, the eggs already infected by this ALV. The same thing also happened to reticuloendothelial virus. So ALV and REV, it must be free from the uh, from the chicken breeding. Okay, here this is the pathology of the tumor here. So can you see here in Marek disease, they cause tumor first in nerve, peripheral nerve, in particular the nerve in the legs, we call it as sciatic nerve or ischiadicus nerve, and also nerve in the wing, we call it as brachial nerve. And beside that, Marek can cause tumor also in the internal organs, like in the liver, spleen, kidney, and so on, even also in the lung. And here, the characteristic of Marek disease, they can cause also tumor in the feather follicles. So therefore, the detached feather follicles can have high load of viruses. And here, this is also the characteristic of Marek. They cause tumor in the eye. It makes the eye become grayish in color, and also the eye shape uh, will be different between right and left side. Okay, there will be, yeah, different form, different shape of eye can be seen in cases of Marek. And usually the clinical signs of Marek can be seen around 8 to 10 weeks, but this is in the literature. However, uh, in some cases, we found that the clinical signs of Marek can be found in younger chicken, even chicken with 3 or 4 weeks old already show clinical signs caused by this Marek. And then also for ALV, they do not cause tumor in the nerve, okay, whether it is a peripheral and also central nervous system, but ALV mostly they cause tumor in the visceral organs, in particular in liver. It makes the liver swollen, very big liver. Therefore, this case also called as a big liver disease. And ALV usually cause clinical symptoms at in chicken that older than 24 weeks old. Just like ALV in the REV, they also cause clinical symptoms after 24 weeks old. However, different with ALV, in the reticuloendothelial virus, it causes a nerve tumor. The nerve become enlarged, and we can also find other visceral tumor. Okay, so sometimes when we perform necropsy between MD and REV is difficult to differentiate. Okay, so we can differentiate between this disease at least by using histopathology. Or if we have doubt, if we are not sure in the histopathology, we have to use other technique, for examples like immunohistochemistry or molecular tests like PCR. Just like I said here, not all tumor cases could be observed grossly as well. So uh, usually this is in the early age in chicken. The tumor not yet developed into large mass, but sometimes the symptoms already appear. Here, this is necropsy results of some of these disease. For example, this is a tumor caused by avian leukosis virus subgroup J. Here, this is the tumor mass in the bone here. Here, tumor mass in the bone. It causes also inflammation. Therefore, can you see here this wet uh, wet looking appearance here? This is actually exudates that caused by uh, tissue damage following the tumor invasion. Here, tumor, but also the tumor invade the surrounding tissue and then makes surrounding inflammation. And then here, this is muscles. Okay, this is muscles also with tumor. But in case of avian leukosis, we seldom found this tumor in the muscle. Most of the muscle tumor can be found in Marek disease. And here, this is the enlarged liver. Can you see there's a small whitish spot here? Here, small whitish spot in the liver. This is actually indicates the formations of a tumor nest within the liver. Okay, and here this is the enlarged spleen. because of tumor formation inside, and you can compare the normal with the spleen from infected chicken here. Very significant differences, in particular in the size of the organs. Right here, this is also cases of a tumor, but this is occur in eye. Here, this is the normal eye. This is eye infected with tumor. Can you see a symmetry between this eye? This is the left eye. This is the right eye. Here, can you see the pupil shape here? It's round. Okay, and this is the iris here. Okay, with smooth edge here. But however, in the tumor that caused by Marek, the tumor can be located here in the iris, and the tumor invasions make the shape of the pupil become distracted. And here, can you see the rough edge, uh, rough edge in the pupil here? All of this caused by tumor invasion. Okay, and if it's become severe, late stage, the eye become grayish, or we call it as gray eye. This is a typical finding in cases of Marek in chicken, eye tumor. Okay, here, this is the iris, the iris of chicken that invaded by Marek tumor cells here. Can you see also the pupil, the shape of the pupil here become this orange shape here. Usually it should be round, the pupil, but now it's become ellipsoidal form. Here, this is the visual tumor. This is cases of Marek tumor in the lung. This is the normal lung. This is lung affected by the tumor. Here also, in cases of Marek, we can see tumor in the surface of the heart here. This white spot actually a tumor nodules. This is also here and here, the tumor nodules caused by Marek. And grossly, in all of these diseases, Marek, avian leukosis, and reticuloendotheliosis, they cause also enlargement of spleen. Okay, enlargement of spleen, first enlarge, and you can see some small whitish dot. However, this small whitish dot in late stage can become spread and makes a larger whitish spot area. If we check using histopathology, we can see the tumor formations, and then if we cut the organs, we can find the nest of the tumor, causing a multiple nodules within and also in the surface of the spleen. All right, this is a tumor mass in the liver. It can be seen also in cases of Marek, avian leukosis, and also reticuloendotheliosis. Here, this is the tumor nest. Okay, it really looks severe, right? Okay, this one also the appearance of the tumor. So this one here, I think this tumor can be seen in cases of avian leukosis, usually caused by avian leukosis subgroup A that cause a disease we call as lymphoid leukosis. Therefore, these cases called as big liver diseases because the liver is not quite with very large. It occupy the coelom, or it occupy the thoracic and also abdominal cavity of chicken. Here, this is also enlarged liver. Can you see the asymmetrical appearance between these left and right lobes here? This is due to tumor formations. Besides avian leukosis, besides the leukosis lymphoid, it also can be seen in uh, reticuloendotheliosis and Marek disease as well. And then in the cut surface, okay, we will see some whitish appearance around the blood vessels like this. This probably indicates the tumor formations. Uh, Usually, formation of tumor around the blood vessels like this can be seen mostly in cases of Marek disease. Here, fissile tumors, I think this is due to Marek in the liver. Okay, very large liver with asymmetrical appearance between the right and left lobes. And also in cases of Marek in particular, it causes also the tumors in the proventriculus. So there will be enlarged proventriculus. If we cut the proventriculus, we will see the tumor nodules occupied all part of the proventriculus, make also reddish appearance due to the tumor invasion causing inflammation as well in the proventriculus. Just like it said in here, thickened proventricular walls. And this is a tumor caused by Marek that invades the intestine and also the mesenterium of the intestine. Here, this is the tumor mass. It can be very small or become a large nodules. However, avian leukosis tumor can cause also tumor in the intestine. Here, like this, similar with cases of Marek. So differentiations of this tumor by using histopathology is extremely important. Here, this is a tumor in ovary, and can you see also the shape of the kidney here? It has a same a symmet a the it's not symmetrical between the left and the right lobes of the kidney. Probably the enlarged lobes already affected by tumor formations. But in here, I would like to stress on the formation of tumor in this ovary. So this ovary is not developed. However, can you see there are some solid area, okay, in the ovary? This is due to the tumor formation within the organs. Next, this is a actually this is already show a tumor, a bit asymmetrical, enlarged kidney lobes here. However, in the severe cases, it can be like this. We can find this is in the case of Marek, avian leukosis, and also reticuloendotheliosis. Okay, this one here, can you see the differences here? Please put more attention on these organs. This is the peripheral nerve in the left side here, peripheral nerve, and this is the right side of the nerve. Here you can see this part of brachial nerve. This is on the close to the wing, okay, in the joint of the wing here. In here, the brachial nerve is larger compared with the other side, compared with this. Larger brachial nerve like this actually due to tumor formation inside the nerve fiber. Here also the sciatic nerve or nervus sciaticus in Latin. So there are also asymmetry, different size of tumor, different size of nerve or peripheral nerve between this left side and right side. This is this findings is typical for Marek diseases, and even it also called as the most characteristic lesion in Marek, and even this is also considered as a pathognomonic lesion. It means if you found a different size of the nerve between left and right side like this is indicate the Marek disease. Without no doubt, we can consider this as Marek diseases. Okay, easy to recognize, right? However, in fields, in cases that we've been see so far, these findings not always occur. Okay, but if you find different sizes of peripheral nerve like this and also accompanied by paralysis of the chicken, yeah, you can easily consider this as Marek disease. Here, this is the spinal cord, and this is the branch of the spinal cord, or we call it as the dorsal root ganglia. Between here, between the right and left side here, it has different size and different shape as well. Here, this is the less affected part, but this is the severely affected part of the dorsal ganglia. And this is a typical appearance in cases of Marek diseases. This is also formations of tumor in the feather follicles. Here it can be seen in the neck of this chicken. Okay, here can you see? And large mass in the feather follicles. However, you can also see this is ulcerated part or open wounds due to the tumor invasion to the surrounding area. Okay, this is typical cases of Marek diseases. Right. Here, this is the feather follicles with tumor appearance in cases of Marek. So you can recognize this after you unplug the feather follicles. This is also skin tumors in the feather follicles here. Can you see the size of the feather follicles? Besides it causes bumps, but also it makes a different size of feather follicles here. And if we look by using histopathology, here this is the skin, this is the muscle beneath the skin. It has tumor, and actually this tumor originated from the feather follicles. If we look with higher magnification, we can see the tumor cells, and the tumor cells has different size of cells here, indicating Marek diseases. Histopathology here. This is the necrosis in the feather follicles, and here this is a tumor mass inside the feather follicles. Here, this is a tumor actually, but this is not in feather follicles. The tumor located in the subcutaneous area. This tumor actually in the fatty cells in the subcutaneous area, in the subcutis. It causes a tumor cells in the fat. We call tumor cells. No, not in the fat. I mean the tumor cells invading the fatty tissue just under the skin. Here, this is the subcutaneous tumor here. Probably this is also can be seen in the cases of Marek disease. Here, this is a formation of tumor inside the bone, in particular in the breastbone or in the sternum. This is typical cases of bone tumor, not in Marek, but in cases of my myeloid leukosis caused by avian leukosis virus subgroup J here. Here, this is the tumors in the ribs. Okay, most of these cases can be found in cases of ALVJ infection, the myeloid leukosis. This one also, bursa fabricis tumor in the bursa of fabricis. So can you see this is enlarged bursa fabricis due to tumor formations? In our experience, if we see enlarged bursa fabricis, most of these cases do not caused by Marek disease, but tumor enlarged bursa fabricis by tumor formations. This usually found in the case of lymphoid leukosis causing by ALV subgroup A. Here, this is the tumor in the liver, but can you see the bumps of tumor have red colors? Actually, this tumor uh, actually this tumor arise from the blood vessels, therefore it called the hemangioma, multiple hemangioma, or in short we call this as hemangiosarcoma. Okay, so a malignant tumors in that arise from the blood vessel. All right, so however sometimes we can also observe the tumor disease by looking at the clinical signs. In cases of Marek disease, because Marek disease invade or causing tumor in the peripheral nerve, like in the brachial nerve in the wing, or also the sciatic nerve in the leg, you will see a paralysis. Okay, you will see a paralysis, and even in cases of Marek, they also can cause tumor in the other nerve beside the brachial and sciatic nerve, but also in the vagus nerve. And in cases when they cause tumor in the vagus nerve and makes the damage in the vagus nerve, it makes also enlarged crops. So the crops of the chicken will be so large, and the feet will be retained on that side. Okay. Here, this is the microscopic lesions. Just like I mentioned before, they will have pleomorphic lymphocytes and also causing damage in the nerve layer, in the nerve cells, in the peripheral nerve tissue. For example, they causing demyelinizations and proliferation of Schwann cells. These cases of Marek disease not only in the peripheral nerve, but also can cause diseases or can cause a lesion in the central nervous system, in particular in the brain and spinal cord as well. Okay, here in the brain. So invasion of the tumor causing necrosis, or we call it as malacia of the brain. In REV, they will also cause nerve tumor. However, the shape of the tumor and also the origin of the tumor is different compared with Marek. So in Marek usually a pleomorphic lymphocytes, but in REV usually are lymphoblasts, large cells, and it has similar size. Here, this is the normal histology of the peripheral nerve. And this is a peripheral nerve affected by Marek disease. Can you see the tumor here? This is the lymphoid tumors that can be seen infiltrating the peripheral nerve and also the surrounding area of the peripheral nerve. Here, this is the nerve tumor. In here, you can easily observe the different size of the tumor, large tumor, small lymphocytes here. Yeah, this is typical findings that we can find in cases of Marek disease. The tumor infiltration, tumor invasion, if it spread to surrounding area, it causes nerve damage in the peripheral nerve tissue, causing a demyelination. Can you see this is multiple vacuoles here? So many vacuoles here. That's due to necrosis or damage of the nerve fibers. Here, this is the tumor around the blood vessels in the brain. Okay, just like you learned before in the systemic pathology practice, histopathology practice last semesters, you can find in the brain here. This is the brain blood vessels. So as you know that in the brain blood vessels there are a small space we call it as virtual Robin space, and in cases of Marek disease, the virtual Robin space will be occupied by the tumor cells, and damage of the blood vessels makes supply of nutrients and supply of oxygens to the tissue become impaired, and eventually it causes uh, necrosis in the nerve tissue in the central nervous system in brain, causing what we call as malacia here. Okay, empty fog walls, that's due to lysis of the nerve fibers. So this is the comparison of the histopathology between Marek disease, ALV, and REV. You can see from the tumor formations in Marek, it should cause a pleomorphic tumor, different size, different shape. It can be in the visceral organs, skin, nerve cells, nerve tissue like peripheral nerve or central nervous system. However, in ALV, mostly in the internal organs and bone marrow, and REV, visceral organs can be affected, and also the nerve actually. But in REV, the nerve that usually affected by REV, reticuloendotheliosis, is the peripheral nerve. We seldom found, I think from the literatures, we haven't found REV in the brain. Okay, uh, this is tumor cells. Okay, in the case of Marek disease with different size and different shape of the tumor cells, and in cases of tumor cells caused by Marek, you can see these cells like this with highly stained nucleus. The nucleus also has a elongated morphology. Okay, I will zoom this part here. Here, elongated morphology with highly stained nucleus. This is indicate the mitosis of the nucleus. Okay, in cases of Marek tumor, you will find high number of mitosis in the tumor cells. Okay, here can you see? This is also, sorry, this is also the cells with mitosis. Here, this is the liver tumor caused by lymphoid leukosis. This is the histopathology. This is the tumor nodules filled with tumor cells. Okay, it can be in the parenchyma of the liver or around the blood vessel as well. So this is a Marek tumor morphology, pleomorphic, large cells, small cells, okay, and with mitotic cells, mitotic figures. And on the right side here, this is the myeloid cells, the myelocytic cells with red granules in the cytoplasms. Okay, usually the nucleus will be located in the periphery of the cells. This is typical cases of myeloid leukosis caused by the avian leukosis virus subgroup J. Yeah, we found many cases of this in our necropsy room. Here, the myelocytes not only can be found in bone marrow in particular, but also can be found spreading to all organs in cases of myeloid leukosis caused by ALVJ. Here, this is the myelocytes in the liver in the dilated space of Dieze. Here, this is the hepatocyte, and between hepatocytes and sinusoid there is a small space, we call it as Dieze space, but in here the Dieze space enlarged and filled with the tumor cells, the myelocyte tumor cells. And this is the histopathology of tumor cells inside the ovary. This is the red granule cells or the myelocytes in the interstitium of the ovary. And this is also the lymphoid tumor cells caused by Marek disease in the interstitium of ovary. Okay, this is the myeloid leukosis virus. Myeloid leukosis tumor with many myelocytes in the organs. Here, this is located in the interstitium of the ovary. And in ALV, the tumor originated from the lymphoblast tumor, okay, or myeloid tumor, can be seen mostly in the spleen and also inside the follicles of the bursa fabriceus. However, for Marek disease, okay, here, can you see for Marek disease compared with ALV? ALV is in the intrafollicular, inside the follicles, the tumor. However, in the Marek disease, the tumor located interfollicular. It means it's between the follicles, not inside the follicles. Therefore, for Marek disease, because the tumor develop between the follicles, it makes the follicles can be atrophied and makes the bursa also become smaller than normal. It's different compared with ALVJ, because in ALV, LAVJ or other type of ALV, they cause tumor inside the follicles, make the follicles enlarge, and eventually leads to enlargement of the whole bursa of fabriceus. And Marek disease in the vascular, in the blood vessels, they cause atherosclerosis due to chronic damage of the blood vessels. However, in ALV, the tumor can be also circulated. They cause also damage in the blood vessels, but the tumor also can be circulated in the peripheral blood. Okay, and from there, the tumor can easily spread to other organs. Here, this is the interfollicular bursa tumor. So can you see the tumor follicles, for example, in here? It goes a vacuolated area that indicates the necrosis of the bursa fabriceus follicles. However, between the follicles, you can see some purple accumulated cells here. This is the tumor cells actually. The tumor cells in Marek located here between the follicles, and it invades the surrounding area, make damage and atrophy of the bursa fabriceus follicle. Yep, if we look closely with higher magnifications, this is the Pusa fabricis follicles, and the tumor will be found in the interstitium between the follicles. And this is AALVJ, Avian Leukosis virus subgroup J, causing the myelocyte tumor, and the tumor cells will be seen inside the follicles of the bursa. Oh yeah, this is ancillary tests or supporting tests to make further identification of the tumor by using a antigen detections of molecules like MATSA. MATSA is Marek disease associated tumor surface antigen. In case of ALV and REV, it should be negative, but uh, in cases of ALV and REV, it should be negative. But for Marek, it will show uh, expression. Although expression is not 100%, but low expression of MATSA antigen, this is by using immunohistochemistry, already indicate the Marek disease. And if we look on the subsets of the lymphocytes, mostly in the Marek disease caused by uh, T cell tumor, about 60 to 90%. However, in the ALV and REV, mostly are B cells. Sorry, for ALV is B cells, and for REV or reticuloendothelial virus, almost similar with MD. It goes by T cell proliferation as well. Okay, therefore it's difficult to differentiate between MD and REV only by histopathology, only by necropsy. But if we have some doubt to differentiate between this disease, we can use the MATSA test. In cases of REV, it should be negative. Okay, and IgM also very low in cases of MD and REV, but it's high IgM immunoglobulin M in the cases of ALV. Here, this is the paralysis of the wing and legs due to Marek disease. And for ALV and REV, we will not find a paralysis in the legs and wing like this. Okay, in ALV, REV, mostly our subclinical symptoms happen. The animals do not show any specific clinical symptoms. Here, paralysis. Paralysis in the affected area by, in the case of Marek disease. Okay, very typical cases. This is the symptoms that can be seen in Marek disease, from paralysis of the legs, the wings. Usually the paralytic wings and legs occurs in the area with tumor formations. And they will also cause torticollis. It means it makes a torticollis due to diseases in brain, okay, in particular in the cerebellum. Torticollis head tail, okay. I think you can find in other diseases as well, just like in Newcastle diseases. However, in Newcastle diseases, the paralysis in legs and wing cannot be found. It can be found only in case of Marek. Here, this is avian leukosis virus infections. This is in the chicken. This is the normal chicken. This is the avian leukosis virus infected chicken. So, if you see the difference here, the comb and wattle formation in the ALV infected male has a slower uh, growth of comb and wattle. Why? Because these secondary sexual differentiations uh, in case of ALV can be seen. I mean, uh, in cases of ALV, because they cause disease, they cause tumor also in the testes or in the ovary if it's in a female. It makes the secondary sexual appearance like comb growth and wattle growth in cases of ALV can be inhibited and makes the comb and wattle growth is slower compared with the normal chicken. How to prevent this disease? For Marek disease, LL, ALV, and REV, of course, strict biosecurity measures must be performed. Okay, if there is infected chicken, it should be removed. The positive chicken should be cooled or removed because they become a carrier. And however, in Marek, beside a strict biosecurity, vaccination also can be applied. But for ALV and REV, there's no vaccines available for ALV and REV. Okay, so biosecurity is the most important measures, the important way to overcome or to handle this disease. Some non-specific lesion can be happen in cases of Marek, ALV, or REV is the ruptured eggs causing a peritonitis due to ruptured egg, or we call it as egg yolk peritonitis. So usually due to tumor formations in the ovaries makes ruptured egg follicles, and the ruptured egg follicles causing peritonitis. Here, this is the tumor cells in the interstitium. It's non-specific tumor formation in the ovary, but we can differentiate between REV, between Marek, avian leukosis, and also reticuloendotheliosis by looking at the shape or the morphology of the tumor cells. This is the tumor formations in the intestine and causing inflammation of the intestine, causing arthritis. It can be seen in cases of Marek disease and also avian leukosis virus, and also uh, uh, from the literatures it can be seen also in the reticuloendotheliosis. Here, intestine with tumor formations, and the tumor can be seen in the mucosa or under the epithelia. Yeah, differentiation must be made by looking more thoroughly on the at the shape of the tumor cells. Okay, that's all for my explanations on tumor in avian species. If you have further questions, please don't hesitate to ask me anytime. And good luck to you all. And I'm going to continue with the next subject. Thank you.